if we look at this picture over here, this is a very, very basic picture which shows parts of the eye. And we all know that, the eye is oftentimes compared to a camera. So we have the front of the eye, we have the middle part of the eye, and then we have the back part of the eye. So in a very simple way, we can say that the front of the eye is what helps us see clearly. The middle of the eye, where we see this lens, helps us focus. And the back of the eye over here, which is the retina, which is like a film, where we need to have a clear picture of whatever we are seeing. So it's important to understand the parts of the eye over here. And if anything goes wrong in any particular part, it can cause trouble. And just looking at the picture, it's kind of worrisome as to why is my eye so red. And you see like the entire white part has a lot of blood vessels engaged over here. And this is a very typical scenario when a patient will complain of dry eyes. And the typical symptoms in a patient who has dry eyes will say that my eyes burn a lot, they water a lot, and there's a lot of redness. And it's very common in patients, who are a lot on the screen and may have some underlying conditions. So this picture over here is actually an eye which shows allergies. And the scenario is very similar when you compare it to a dry eye. Dry eye will also have redness, and an allergic eye will also have the redness. And they both will seem to be very swollen up. But the basic difference that we see between a dry eye and the allergic eye is that in dry eye, patients will complain that, oh, my eyes are very burning and they're constantly watering. But with allergies, what happens is that you will be constantly itching. You will be constantly rubbing your eye. And that can happen all year round, or it can happen as a seasonal thing. So that's the basic difference. You may want to understand the difference. It's burning versus itching.